So today we're going to talk about submandibular gland reduction. And submandibular gland reduction is kind of our secret sauce for getting very sharp, snatched jawlines. So if you really want to get these beautiful results, oftentimes it requires reducing these submandibular glands. So what are submandibular glands? They're glands that sit here deep in our neck, in that fourth layer of our neck, that contribute to making saliva in our mouth. We have bigger glands that make the majority of the saliva, the parotid glands, sublingual glands, other glands inside our mouth, so that even if we removed all of the submandibular glands, which we don't do, you would still have plenty of saliva in your mouth and not have dry mouth. When we do submandibular gland reduction, we're treating the part of that gland that has either enlarged with aging or sunk down with aging. And you can't just put stitches and tighten that up. We found that if you try and do that, they fall right back down. So oftentimes what we have to do is reduce the size of about a fifth of the portion that's sagging down. So the problem is when these glands aren't treated when they should be treated and a neck lift is done, they can be accentuated and look even worse than they did before surgery. The idea is if we have a saggy neck and you don't see these glands sagging and then you tighten up a neck and leave those sagging glands behind, you're left with these two balls hanging by the side of your neck. And I have people come to me who've had surgery elsewhere and say, hey, is this excess fat? What can I do to make this better? And I tell them we can't liposuction that. Those are the glands and they should have been reduced the first. So why don't other surgeons do submandibular glands? A lot of them just don't have the expertise to work in that area. But as a head and neck surgeon for 25 years, we really know how to access the submandibular glands well. A lot of surgeons who don't do it will say, hey, there's a risk of nerve injury. But in my hands, I've never seen a nerve injury from going after these glands because we know how to do it in the safest way possible. Not only technique, but we use instrumentation that is very high end to minimize the char and the cautery that happens with reduction so that it keeps it as safe as possible. So in summary, not everybody needs submandibular gland reduction. But when I see you in consultation and I point out, hey, we have to reduce these, that's an important part of our surgery. And I can't necessarily do the neck lift without doing that important part. So safe to remove them, done in the safe way by an expert surgeon who knows how to do it, using either the ligature device or excellent technique with a bipolar device is going to allow us to reduce the weight on the hammock. So when we lift things up, we get that beautiful, sharp neckline definition.